My name is Carl Silva. I'm one of the original founders of the system I'm about to show you for CallMyDoc. The system's been built from the ground up, purpose-built for doctors, and to make it as easy as possible for when the doctors are not in the office, when they're on call, to deal with patient calls as easily and as quickly as possible. That's done through an app, which we'll look at in just a minute. The other part of the system is it's entirely self-documenting, so that whoever is on call at 3 o'clock in the morning doesn't have to remember to tell anybody about it because it's already all written down for them and automatically put back into the patient's chart. The other part of our major part of our system is that we can help answer the phone during the day if a particular extension is busy or if no one can pick up that extension, because what we'll do is we take the patient's message or the message the patient's leaving, transcribe it into text, and automatically create patient cases in Athena. It does a couple of different things, and it completely eliminates any manual labor of having to check voicemails, look up charts, etc. And the other part is nothing can get lost or misplaced. It's always going to be there somewhere. So with that little introduction, I'd like to turn it over to Leslie to just mention a little bit about what she thinks about the system, its good points, bad points, you know, and how it can help other practices in what they're trying to do to make themselves more efficient. Leslie?
Hi, good afternoon, everyone. We have been using CallMyDoc for probably about, I guess we first rolled it out about 7 months ago. And we were piloting it, and we were slow to get a lot of our doctors on, but everybody is up on board for, I think it's been about 3 months, and they're really satisfied with it. It's working out very well. Some of the features that I really like about it is that I don't know if you have it from your answering services, but I switched from one to another because we were getting a lot of complaints, and it really didn't change the second one either, from patients saying that it took a very long time for somebody to answer the phone or for a doctor to get back to them, and they were frustrated. The other reason, so we basically have eliminated that complaint. I haven't had one since we went on CallMyDoc. The next feature I really like the most about is documentation. There is a audit trail of that patient's call. There is documentation from the on-call doctor, and there is clear communication to my triage team or my nursing team in the morning on what they need to do for that patient. So it really helps them not get blindsided by a patient following up because the doctor told them to call, to prepare for that call and to really get back to that patient promptly. I really had to rearrange the staff as far as the hours, not much, but just tweak them so that we could optimize the system even better, because part of the services CallMyDoc has are for other departments. And one of that is if the patient is canceling an appointment, they will be able to take that message. It goes into a queue, and it goes to my patient scheduling team, who gets in at 7 a.m. and I have one person who comes in at 7 and 7:30, who will be able to, before our phones go on, look at those appointments in the morning and also work with the triage person who gets in early to look at the triage patients that need to get in. And then they're able to immediately maximize our patients, you know, our schedule that day, because they can see, okay, well, so-and-so canceled, we can squeeze this person in here, we can get them in here. And we have really seen our patient, our schedules get maximized, and that was nice. We went from, I think, 88% max, capacity to 92%, and I believe CallMyDoc was very helpful in that. So I'm very pleased with that aspect as well in getting these patients in. The next part we are going to start using is the patient scheduling piece during the day, because I am down one patient scheduler, and we're going to pilot that and see how it works if we're able to not have to replace that person. Right now, I have 3 people who work on that team. We did have 4, and I think I'm going to keep it to 3 and utilize CallMyDoc during the day. So, because we do a high volume of incoming calls during the day.
And
I hope yeah.
Go ahead. Sorry. No, you first.
No, I hope I've kind of covered how we use it and some of the areas. And if I wasn't clear, you know, feel free to ask questions.
Does anybody have any questions for Leslie?
Yes, Leslie, it's Joanne. So,
Hi.
Hi. So the last part interests me because one of the biggest complaints that we get for our phone system, at least anyway, is people not being able to get through. And, you know, how has that impacted? How are you going to use this to, you know, to avoid that one? Do you think it will avoid that?
Are you talking about during the day?
During the day, yes. Yes.
Yeah. Right now, with our 4 patient schedulers that we had, we're down to 3. We would have, each one has a voicemail, and if patients couldn't get in, it would roll based on where the last call went, the system, and they would all have messages into their voicemail. We're going to eliminate the voicemail so that CallMyDoc picks these up and can then route them to the right person based on the need, based on who that patient wants to see, because they're assigned certain providers, each one.
Okay.
So that should really help them, and then they can better prepare for the call. We do have our patients, most of them are answered by a human. I'm hoping that CallMyDoc will just expedite that patient to have that returned call promptly. And we'll see. What I'm doing also is having the front desk also be part of that call if the patient schedulers can't get to it. And if they can't get to it, CallMyDoc would step in. So I don't think, by adding all of my front desk to it, I don't think we're going to have a difference that patients will feel. I just think that CallMyDoc will get that call returned faster, because it won't be sitting in a voicemail where you have to worry, did a person check it? You know, did they forget about checking their voicemail? That type of stuff. With CallMyDoc, it's going to go into a queue where we can monitor it and see that there's a call that hasn't been returned, and somebody can be assigned it quickly.
Okay, thank you. I think that, you know, as all of the you know, people are getting more used to, we try and have a human being obviously answer the phone, but as you know, I mean, when we get the mass amounts that we do, unfortunately, it does trip into the voicemail, you know, and there's a lot of pressure there for the staff to get back. And if there's urgent calls, we do definitely have an urgent line. But if there's anything that is ever brought up on Press Ganey, it is the whole phone system of not being able to
Sure.
get through sometimes. So if this is something that's going to be helpful, then I'm definitely interested in it.
Well, another way it will also help you, and I'm sure you see this, that often the calls, even when you have prompts, patients pick anything sometimes.
Yes, exactly.
So a lot of the calls go to the wrong person. And if you have your queue set up to be able to identify these calls and have it drop to the right person, it also saves time with having to reroute that person and connect them, or build up their voicemail with unnecessary calls.
Right, right. Okay. Was it easy to set up, Leslie?
Not hard at all. Not hard at all. Carl's really good at walking you through that. And we've also, I think we've learned a lot from this system by piloting it. And certainly if you have any questions, you can reach out to us, and you know, you could even send somebody if you want for them to, if they're going to be in charge of it. What I did, Joanne, was assign this to a person in my office who oversees the whole process and is responsible for keeping her eye on the queue and checking the queue in the morning when she comes in and making sure that they were routed to the right way. And they're the ones who work with Carl to set everything up. If they have problems, a provider brings something to their attention, you know, it goes to that person. So she's really, really knowledgeable about it.
Okay. So let me just clarify. You now do not have the answer service at night. This is replaced.
No, I don't have an answering service. I cut that off.
Okay, good. All right. All right. Interesting. All right.
So I have a couple of questions.
Sure.
Okay. So I'm sorry, this is Doreen from CCOG. So what about the hesitation with my doctors, because we've looked into this before, the hesitation is not having a human answering the phone in the evening. Has there been any hiccup with that?
No, you know, it's amazing. The patients get used to it. And I think because more and more offices are using an automated system, so pretty much, I think what we found were the older patients that had an issue. But overall now, I think they just get used to it. We explained it to them when they called, and I have had very few complaints, very few. I actually had more complaints using the answering service, complaining about it's taking forever for somebody to pick up. So I would have to at night just randomly test them. And, you know, and I would call and it would take them a long time. And I would say, you know, I'm getting complaints constantly from my patients and I'm testing this and I can understand it took you, I was on hold like almost 10 minutes. So I don't have to go through that anymore. And the big thing I'm anxious to see is when there's a major snowstorm, I found our answering services really imploded because they could not keep up with having to manage the volume of calls going to them during the day and the evening when an office was closed.
Now, when you went over, did you keep the answering service as a backup or did you just like flip a switch one night and did the transfer?
Good question. Yes, I did keep it. I kept it as I rolled it out. I did not roll every doctor out. It depends on your size. I have a huge office and a lot of providers. So I rolled it out slowly. I didn't roll it out, you know, everyone. Looking back, I probably would have do it a little differently. I probably would have rolled it out to the 2, had everybody do a training with those 2 doctors and do their webinar that Carl has, and then just cut the switch because it almost is like, you know, you pull a Band-Aid off. You just do it quickly. You're better off. But with the answering service, until everybody was converted and comfortable on it, I kept them. Then I ended up, and I had to give them a 30-day notice, so I just let them know 30 days before I was planning to cut it off.
Okay. Okay.
Any other questions? Okay. So what I like, it's easy to explain what we do is to show you. And as we go through this, any questions you have, just please bring them up. I really appreciate what you just said, Leslie, about everything, because this is for Women's Health in Connecticut. This is to share information, and this is one of the fun parts of my job is seeing how much we can help doctors and practices in any different location to make everything easier for everybody that's involved, both the doctors and the staff. I'm also going to show you guys different examples of implementations of OBGYNs around the country that use this after hours and during the day of different sizes too. So when I call into the system here, Leslie's system is set up a bit different from what I'm about to call into because at the end of the day, 95% of everything you're going to hear right now is completely customizable. We have a zillion different configuration parameters. And the easiest way to look at our system is to just say, look, this is the way we want it to work. Can you make it do that? And then we'll figure out how to make it match your needs and requirements according to, the way you want to run it. Whether it's during the day, after hours, 24 hours a day. So I'm going to call into the system here, and we'll do a patient call. I'll show you what happens.
Press 1 for English.
Hang on, that's my phone. It's not. Try that again, shall we? Here we go.
Press 1 for English.
Pressione 2 para espagnol sur 3 pour le français.
Hang on. Let me call in with the phone. I don't know why that's doing that.
Hi, press 1 to be connected. Thank you for calling. All calls are
Sorry, it's a bondage phone. Hang on.
Press 1 for English.
Presione 2 para español. Appuie.
Please select an office. Press 1 for Prime Clinical Test Office. Press 2 for Athena Health Test Office.
Welcome to Athena Health Test Office. The office is currently closed. If this is a medical emergency, please call 911 or go to the nearest emergency room. If you are an existing patient or calling on behalf of an existing patient, please press 2 immediately to be helped. Please enter the patient's date of birth by using your keypad. Enter 2 digits for the month, 2 digits for the day, and 4 digits for the year of birth.
Doing.
You have entered September 18th, 0963. If this is the correct date of birth, press 1. If not, please enter the patient's date of birth by using your keypad to enter 2 digits for the month, 2 digits for the day, and 4 digits for the year.
What is wrong with this stupid phone? I'm sorry about this. Hang on a second.
Press 1 for English. Please select an office. Press 1.
Welcome to Athena Health Test Office. The office is currently closed. If this is a medical emergency, please call 911 or go to the nearest emergency room. If you are an existing patient or calling on behalf of an existing patient, please press 2 immediately to be helped. Please enter the patient's date of birth by using your keypad to enter 2 digits for the month, 2 digits for the day, and 4 digits for the year of the patient's date of birth. You have entered September 18th, 1963. If this is the correct date of birth, press 1. If not, please wait while we look up the medical chart for the patient. If you have an emergency and need to speak with the doctor on call, press 1. If you have a question about your schedule or to request or cancel an appointment or get directions to your next appointment, press 2. If you have a question about your bill, labs, insurance, or some other message for our office, press 3.
I'll explain those options more in a second. Let me press 1 to reach the doctor on call.
Would you like us to return your call to 310-561-8055? If yes, press 1. If no, please speak the patient's full name slowly and clearly. When done, press any key. Then you will be asked for more information.
Call Silva?
Now, please leave a detailed message. Please speak slowly and clearly. When done, press any key.
Doctor, I lost the prescription that you gave me, so I was wondering if you could call in a refill of the little blue pills you prescribed to me 3 years ago.
Once a doctor or office has listened to your message, we will contact you at 310-561-8055. You will be receiving a call back from 844.
Anyways, sorry about that little mix-up at the beginning. One of these phones is whacking out for some reason. It's got nothing to do with CallMyDoc. So what happens is we give every practice its own dedicated phone number. Could be an 844 number, it could be a local number, depending on which is the most compatible with your phone system. And you forward your phones to it like you would any other answering service. And so when people call in, when patients call in, they're asked to enter their date of birth. Basically, we act like a virtual front desk person, because if somebody calls your practice now, it doesn't matter who's calling, the front desk is always going to say, okay, what's your date of birth? I need to look up your lab results, etc. We just do this exact same thing. And if there's more than one patient with the same date of birth, we'll prompt for the first 3 letters of the patient's last name. And there's no patient training. I mean, as Leslie mentioned, patients just start using it. The system you're looking at now is currently deployed in 34 states, and we handle 97,000 patient calls a month. And people just use it. You have a phone, you remember when you were born, no problem, we can use the system. Once we've identified who they are, there's 3 things they can do. Now, if this was set to day mode, it would say press 1 to leave a message for your doctor. We would take down the message and we would transcribe that into a clinical patient case in Athena. However, after hours, it goes to the app, which I'll show you in just a minute. Press 2 is something to do with the schedule. Now, when I press 2, there's 3 things that it could do. It says press 1. If you want to request an appointment, we will transcribe that into an administrative patient case in Athena. Press 2 if you want to cancel an appointment. And again, don't forget this is programmable, but if you wanted to, when they press 2, it could literally cancel their appointment and take them off the schedule. It behaves like your front desk does. So if somebody's trying to cancel an hour ahead of time, and you have a 24-hour cancellation policy, it'll say, I'm sorry, we can't cancel that appointment right now. Please call the office back. The third thing they can do under scheduling is it'll say, press 3 if you want us to text or email you your upcoming appointment information. And not only does it send them their appointment information, but it also attaches a hot link to Google Maps so that when they click on it, it will tell them exactly step-by-step how to get to their appointment. The other thing we can do under this section, if it's enabled, is if you have any appointment types enabled through the patient portal, we can actually allow the patient to schedule their own appointment in under 30 or 40 seconds over the phone without anybody even being involved. And I'll actually show you that as part of this demonstration. So first thing is I want to reach the doctor on call. Second thing is something to do with the schedule. And we try to put as much in there is because 40% of every call to your practice at night or during the day is going to be something to do with the schedule. It turns just across the country, 40% of all calls are scheduling questions and issues. So that's why we try to put as much in there as possible so that CallMyDoc can handle the patient's request without somebody having to be involved. And then the third choice exists is because when people call in your office, they're not calling for a cheeseburger. They're always calling about the same stuff. The billing question, I need a refill, I need a copy of my medical records, etc. Again, keep in mind everything I'm saying can be changed and adjusted according to how you want to run things. But if I press 3, it'll say press 1 if you have a billing question, press 2 if you have a medical records question, etc. And then what we do is because in Athena there's 12 different types of patient cases, we'll transcribe their question into the different patient case types. So we completely bypass anything to do with voicemail, goes right into different patient cases, and each patient case type can be assigned to different buckets, as Leslie mentioned. So it makes the whole process really efficient, whether it's being used at night or during the day, to handle patient calls that can't get answered by a live person. So now I'm going to go to the app here. And I have an iPhone on my screen, but it doesn't really matter. I could have an Android and an iPhone laid side by side. The app looks identical on both of them. The notifications the doctors get and their preferences towards notifications is totally programmable. So in this case, I have it set to literally wake up and say, you have a patient call. I also have it set to text me, and I also could have it set to call me within 15 minutes to remind me to open the app. Right now, I have to put in a PIN code because I haven't touched it in a while. And most people stay logged in 24 hours a day. And this way, if I set my phone down, someone can't just look at patient calls. Now, that photo and the name is being pulled in real time from the patient's chart. We match it on an as-needed basis. We don't keep copies of any patient information. So when I click on it, it's pulling more information off the patient's chart. And it's way different than the way things work today. I can screen my own calls. This isn't like a surprise call out of the blue. I can see who the patient is. I see why they're trying to reach me. And if their transcription's a little funky at the bottom, I can always play it.
Sofa, doctor, I lost the prescription.
And the reason why the transcription might be funky is because, patients might be calling in while they're standing next to a hairdryer or something. But in any event, I know who this patient is and why they're trying to reach me. And then what you do with your finger or your thumb, you swipe in front of the screen from right to left like you're rotating a cube. And now I've got date of the last visit and some vitals. I got problem and diagnostic codes from the 3 most recent visits. I've got allergies. I got medications. And this section that says labs and other documents, not only does it have the 3 most recent labs, if they had an OB episode on their chart, all the OB episode information would be listed out here. Each section of the OB episode information would appear like these little things I can click on and view. So, notification, who's this patient, why do they want to talk to me, what's happening with this patient lately, I might be on the call rotation schedule, maybe I haven't even seen this patient before, but at least I got a clue what's happening in the 3 most recent visits. And you swipe the screen from right to left again, you hit this button called Take Session. Now when I hit Take Session, that indicates to CallMyDoc to keep track of everything, because when we finish with this call, it's going to wind up documenting the whole thing and putting it back on the patient's chart. So the whole phone encounter gets documented. If I want to call the patient, I hit this phone icon and I hit this green bar. It's going to call me first. Theoretically. Here it is.
Patient, connecting you with the patient or caller.
I'm going to hear music on hold. Now, once it's connected to me, it's going to try to connect the patient on a different phone line. So it's calling the patient with the caller ID of your practice.
Hello, this is a Athena Health Test Office calling you back. The doctor would like to speak with you now.
We're connected. And the echoes just because both phones are in the same room. Let me just wait for my screen to catch up to my app. The screen's a teeny bit slow, but it's not the app that's... Okay, great. So, click on End Call. The thing is, a lot of patient calls don't require me to call the patient right back. This little test call we did is just about a refill. So when I click on Add Response, this is all the things CallMyDoc can do on its own. Send in the prescription, update the chart, call the patient back and tell them where to pick up their prescription, and I don't have to call anybody back. So I'm going to click on Prescribe. Again, it's pulling the latest meds off the chart. I could hit the magnifying glass and prescribe anything, but I'll just pick up this list. Sometimes you have to fill in some of these fields. It's just the way it comes out of Athena. I don't know why, some kind of data licensing issue on their end, but it's pretty simple. Then down here, it pulls the patient's default pharmacy off their chart, but if I hit edit, I could actually search for and send it to any pharmacy in the country. So I'm going to save that response. The other thing I'm going to do is I'm going to send some instructions back to the patient. I send in your refill, but we haven't seen you in over 6 months. So please schedule a time to come in for a medication review. And I'm going to click on Add Response again. Hang on, just wait for the app to catch up. Now you see there where it says Request Appointment? If in fact you had at least one appointment type available for self-scheduling through the portal, we can also call the patient up on the phone by ourselves, schedule the patient over the phone by ourselves, and it takes care of the whole thing. So I'm going to have CallMyDoc call and schedule this patient on my behalf. And then just waiting for the screen to catch up. And then down here at the bottom, there's a box. Now, this is where I document the call, and I tell the staff what I want them to do the next day. Please give this patient a call if they haven't already scheduled an appointment. They need to schedule an appointment to come in for a medication review. And then I hit close session because now I'm done. And now the app's going to do everything I just told it to do.
Hello, this is the Office of Athena Health Test Office returning your call. A patient at this phone number contacted us with a medical issue. We are calling back now with the doctor's answer. If you are the patient or a HIPAA-authorized individual, press 1. Athena Health Test Office has the following information for you. You can repeat this information at any time by pressing 1. Please listen to the entire message. This message has 3 parts. Part 1. The doctor has prescribed the following medicine. Advil 200 milligrams tablet. Daily. The prescription has been sent to the pharmacy. CVS, pharmacy number 9607. Located at 901 Silver Spur Road. Please call the pharmacy to confirm it is ready at 310-377-6745. Part 2. I sent in a refill, but we haven't seen you in over 6 months, so please schedule a time to come in for medication review. Part 3. The doctor has requested that you schedule an appointment. Press 1 to repeat this information. Press 2 to confirm you have heard this message. Please choose your preferred scheduling method for your follow-up appointment. Press 1 to hear the next available appointment time. Please wait while we search available appointments. The next available appointment is 9 a.m. Friday, November 8, 2019, with John Carter 1500. Press 1 to schedule at this time. Please choose one of the following. Press 1 to confirm your appointment for. Please wait while we book your appointment. Okay, we have confirmed your appointment for 9 a.m. Friday, November 8, 2019, with John Carter 1500. Please make a note of it. Would you like us to text or email you your appointment confirmation? Press 1 to confirm. Thank you for calling. Goodbye.
Anyways, you get your CallMyDoc phone number, you forward your patient calls to, you forward your calls to it. If it's an existing patient, they're going to enter their date of birth. So that way, when the doctor on call gets that information, they know exactly who's calling them, why they're calling them, and they can decide what they want to do when they're on call with the patient. Either have the app call them back, or they can call it back themselves, or any combination of those things. Now, this last piece here that's on my screen is what we call the admin panel. Now, in parallel to this created a patient case in Athena. So I'm going to start with this side first. So here's the note. I come in on Monday, and I might put a note in here. And I do that for 2 reasons. One of which is now it's tagged. So as Leslie said, you get an overview of who's working on what and what's happening. The other thing is it also tagged this patient case in Athena with my name in this note too, which I'll show you in just a minute. If I click on request, I can read what the patient said.
Call Silva, the doctor, I lost the prescription.
And this keeps getting better and better, both on the transcription side as well as on the spoken side, because we use the same technology as Google Assistant. We have a very big partnership with Google and a BAA and all that other stuff. I would click on response. This is a summary of all the actions the doctor took when they're on call with a patient. And then the session log is a detailed log of every single thing that happened from the time the patient called in, what language they picked, date of birth, phone number, message, what time did the doctor get notified when they're on call, which literally happens before the patient even hangs up the phone. What time the doctor called the patient back, the doctor sent the patient a message in a refill, what time did the patient hear those messages, et cetera, et cetera, et cetera. And then, as I said, it's also created a patient case. I'm going to explain this a little bit further in terms of this part of the workflow. Well, you got to be kidding me. No way. Oh, Lord. Well, take my word for it. Athena changed my username, and I didn't get a chance to change it to something new. So, unfortunately, I can't show you that patient case. Not something that we did. It's something that I realized Athena did yesterday. So I can't get into that test system. Unfortunately, you'll just have to take my word for it. Now, it created a patient case. You work this stuff the way you would any normal patient case. In other words, you don't necessarily have to use the dashboard to do anything to do with existing patients. If I go and work a patient case and I close it out, that patient case is going to automatically archive this call from the CallMyDoc system when it's closed, because we synchronize two of them together every 5 to 10 minutes. Athena won't let us do it faster than that. But anything that has a patient case in Athena, if it's closed out, it's the same thing as if I clicked on this archive button.
Okay.
I'm sorry, I have to interrupt. This is Doreen. I have to actually exit the meeting. Leslie, I might touch base with you later just for a couple of questions.
That's more than fine. I have to exit actually myself as well, but feel free, anyone who needs to get some help, to give me a call. I'll be happy to.
Okay, thank you.
No
Bye.
problem. So what you wind up with at the end of the day is kind of a dashboard effect. So this is a location we have in Arkansas with 26,000 patients. And we manage their after hours calls because we have a built-in after hours call management system, and it knows who's on call when. But the other thing is that they use this during the day too, so if anybody can't answer the phone, we'll pick it up. So if they get a stat lab result at 4:50 on a Friday evening, it's not going to be sitting in a voicemail accidentally until Monday morning. It's going to be on this dashboard. And you know it's being worked on. So some of these are being worked. This one, Jennifer's working on this one. No one's started working on these two yet. But you always know what's going on, and you always know no balls are going to get dropped, and everything's going to get followed up one way or another if it can't get answered by a live person. Does anybody have any other questions?
Yeah, actually, I do. It's Joanne again. I mean, it sounds all well and good, and I definitely see the benefits of it. And certainly with the on-call schedule sometimes that we have. The only issue, there's a couple of things. The issue that I see might be a problem is that we share on-call with another practice. Now, if you're on board with this, do we just simply, I mean, how does that one work? Do we just simply use it on the days that we be on call, or?
Yeah, it's actually, you described the same situation with Manchester. You know, Jamie, I think it's Jamie Beers. Beer?
Yeah.
All right, so here's the way that works. First of all, so you see Manchester here, they have 3 dashboards, okay?
Yeah.
And the reason why they have 3 is because they have one that takes care of the day.
Okay.
Right?
Yeah.
And then they have this one after hours, because their after hours on call schedule is even more complicated than what you just described. They have, when I call in, it says press 1. No, actually it says press 1 if you're an existing patient or a new patient, okay?
Okay, yeah.
Those are going to go to either the midwives or the NPs.
Yeah.
Or press 2 if you're a physician or a clinician calling and need to speak urgently with the doctor on call.
Okay.
That goes to the MDs, okay?
Yeah, yeah.
Now the second piece is the schedules for Manchester.
Okay.
And the schedules for, I can't remember the other practice they share the calls with. Oh, Mansfield.
Okay.
Everybody on here is either in Mansfield or in Manchester. The difference is, CallMyDoc knows which people have the app and which people don't. So if a Manchester person, it goes through the app. If it's a Mansfield person, it shoots straight through to Mansfield's existing answering service.
Okay, very good. All right.
So you can mix and match as much as you want.
As you can. Okay, that was I guess my question there. All right, very good. Now the next step I know that you know, the other manager was listening in. I don't think he's still on here, but one of his things was that we do need to have somebody come in because the docs, I don't know if they've actually been part of this webinar. Would you do on-site meetings with us to explain it again?
Typically, we do the whole thing through the WebEx because it's extremely easy once we get it set up. I mean, the way that we work is we set you up completely, no charge at all. Okay.
Okay. Yeah.
You get to try it for a minimum of 30 days. In Leslie's case, she actually kicked the tires for over 2 months, which is no problem because you don't have to ditch your existing answering service, you know, until you're ready to cut over. So for a while, we were kind of mixing between CallMyDoc and the existing answering service because remember, you could put your schedule in the CallMyDoc system, and it will send it knows who has the app and who doesn't, right? So we mixed and matched a little bit for a while.
Sure.
As the doctors got up to speed on the app, but like she said, you know, it's also just as easy to kind of just rip off the Band-Aid. In any event, if you decide you want to keep it, it's $99 for the first provider and $29 per additional provider month to month, and that's it. Period. There's no other charges, and if you were to call me a year from now and say we need more phone numbers, no charges for those or any other customizations. Period. It's just the monthly charge. We don't charge all that other stuff. If you don't like it, it's a month-to-month service. There's no long-term contract. You can cancel at any time, but no cancellation fee.
Okay. What was the charge again, Carl?
$99 for the first provider, $29 per additional. That's it. Month to month, no additional charges or fees.
Okay, perfect. All right. Okay, all right. I will discuss it with the business manager. I like what I'm seeing so far, but you know, anything for me that cuts down on, you know, me getting griped at in the morning because of, you know, patients and also providers that are not getting messages. You know, definitely it's something
well, here's the thing, okay? We're working with Greater Hartford Women's Health Associates. They want to try it out during the day first, frankly, because it gets killed during the day too. And so it's a matter of, you know, you can start either way. It depends on what you think your biggest problems are to get solved first, and then gradually ease into some other area. But as I said, you know, we're not going to charge you to make changes. So if you decide to start one way and then add on something later, no problem.
Okay. All right. Very good. I will talk to the other manager. We have a managers meeting and providers meeting next week, and I'll definitely bring this to their attention.
Okay. Well, if you want to do more of a customized one-on-one WebEx with anybody too, we could do that as well. All right.
Yeah, that sounds great. Okay, I really thank you for your time.